Welcome to day 2 of Kidney Action Week and our first session of the day, home dialysis and patient experience. Could home dialysis be for you? My name is Dr. Graham Abra, and I have the great privilege and pleasure of moderating this morning's session focused on home dialysis. Home dialysis offers many patients an improved quality of life through flexibility for diet, more energy in life to do the things that we all want to do as people, have our jobs, travel, flexibility for our lives and all the people that we love in them. But we often see that home dialysis isn't used as often as we think it might be, given the benefits of it, particularly for patients who are Black or Latino. And our goal over the next hour or so is to talk about not just the barriers, but really the solutions, the things that we can do to bring home dialysis as an option to more patients. Just to give you a little bit of background about myself, I am a clinical assistant professor at Stanford University and the vice president of medical affairs and home therapy at Satellite Healthcare, which is a nonprofit dialysis provider. I served as the medical director of Wellbound San Jose, a wonderful home dialysis center, for about half a decade. My clinical practice focuses on the care of patients with advanced chronic kidney disease, with an emphasis on home therapies. And at Satellite Healthcare, I help to oversee physician leadership, home dialysis quality programs, and the care of over 1,600 home dialysis patients. While I can provide a bit of insight about the physician perspective of the benefits and barriers to home dialysis, I am incredibly grateful and privileged to be joined today by another nephrologist that also specializes in home therapies, as well as, incredibly importantly, two patients who can speak to their own personal experiences with home dialysis and how it has impacted their lives. So first, it is my great pleasure to introduce a colleague, Dr. Rachel Pearlman. Dr. Perlman enjoys taking care of dialysis patients, especially people on home dialysis. In addition to her clinical work in nephrology, she is very committed to medical education. Dr. Perlman teaches at the University of Michigan Medical School and serves as Associate Program Director for the Internal Medicine Residency Program. She has published extensively articles on dialysis, anemia, as they relate to the care of patients with chronic kidney disease. I am also very privileged to be joined by Nieltje Gedney, who is the Executive Director of Home Dialyzors United. She comes to Home Dialyzors United as an 8-year solo home hemodialyzer and has 20 years of proactively managing chronic kidney disease due to acute kidney injury. Nieltje's patient advocacy stems from her experience on Capitol Hill, beginning at age 16, where she learned that power in numbers can bring about a great change. And rounding out our panel for this morning's discussion is Leigh-Ann Williams. She is a patient ambassador for many kidney organizations who works tirelessly to advocate, educate, and empower people with kidney disease. As an in-center dialysis patient for many years and currently a home dialysis patient, Leigh-Ann's perspective on the different routes available to patient for dialysis is going to be extremely valuable for us today in this discussion. So throughout our conversation today, we will be answering your questions. So feel free to type your questions and comments into the window next to or below the Facebook Live video stream, and we'll try to answer as many of them as possible as they come in. I know we're going to have a really great discussion. I know there are going to be lots of questions, and we got a wonderful panel here to answer them. So let's go ahead and get started and go through some basic introductory information to kind of frame the conversation. So first, I just wanted to start with some of the key takeaway messages that I think are really important for us to understand about home therapies and the benefits they may bring. So home dialysis can mean fewer food restrictions, fewer pills, less pill burden, a less restrictive lifestyle, and better clinical results for patients depending on the type of dialysis that we're talking about. Patients should certainly communicate with their treatment team and explore all of their treatment options. There is no single option for the care of advanced chronic kidney disease. There are lots of possibilities, and they have risks and they have benefits, they have pluses and they have minuses. And understanding those things and being empowered with them is a key to doing well. Home dialysis is not for everybody, but communicating with your nephrologist can provide you the information you require to make a good decision, an informed decision about what fits best with your life. Really importantly with dialyzing at home is the ability to get in contact with your care team, in particular your home dialysis nurse. These nurses generally who care for patients who are on home dialysis are available 24 hours a day, 7 days a week to provide consultation and support and assistance in the case of an emergency in the home. So these are important things to keep in mind. So some basics. What is kidney disease? What is chronic kidney disease? Kidney disease, in particular, chronic kidney disease, is something that is permanent damage to the kidneys. And unfortunately, usually this has no signs or symptoms. And I say unfortunately because it can occur and we may not even know it has occurred because of conditions like diabetes and high blood pressure. Oftentimes, chronic kidney disease cannot be turned around or reversed once damage is there. Oftentimes it is permanent. However, oftentimes that damage can be slowed. And we're really fortunate to be living in a time where there are more medications and more treatments that can help with preventing ongoing damage to the kidneys from a variety of different causes. Chronic kidney disease, particularly if left untreated and unmanaged, can lead to kidney failure, which is also known as end-stage renal disease or end-stage kidney disease. So how do we treat end-stage kidney disease if it gets to the point where the kidneys really stop working? As I mentioned, some people refer to this as end-stage renal disease or end-stage kidney disease, this term when the kidneys really have stopped working well and we start to feel unwell from it. When the kidney function declines to less than 15% or so of the original capacity, we will sometimes see people develop symptoms. Oftentimes it needs to get even a little bit lower than this before we really see symptoms starting to appear. Oftentimes it's even lower than 10% or so before symptoms start showing up. But this 15% number is around what we call stage 5 chronic kidney disease. And when it gets even a little bit lower, sometimes people start to feel sick from it. Your kidney doctor, called a nephrologist, that's what I am a nephrologist, as is Dr. Perlman, who's going to be on the panel here, will work with you closely to determine when it might be time to start treating your kidney failure based on symptoms and lab work. Incredibly important to understand that there are many treatment options for advanced chronic kidney disease, and these include kidney transplant along with dialysis and along with management without dialysis or transplant with medications and conservative management. So there are many options for this, and it's important to understand these by having a good discussion with your kidney doctor. Next slide. So what is dialysis? Dialysis is a specialized technique for cleaning out the toxins that build up in the body and taking out those toxins along with extra salt and water, the fluid that builds up when the kidneys aren't working well. Dialysis replaces some of the work done by your kidneys when they are no longer working. It's unfortunately not a treatment that makes the kidneys better, but it does take on some of that work that the kidneys were doing when they were working well. And there are two general types of dialysis, which we'll talk about a little bit. There's hemodialysis and there is peritoneal dialysis. Dialysis can be done in a dialysis center, a hospital, or at your home. First, a little bit about hemodialysis. Hemodialysis is a form of dialysis where blood is taken out of your body. It's moved to a machine that cleans it and takes out extra fluid. Access to that blood is a really key component of hemodialysis, and this requires preparation typically in order to get that access in place, access to your bloodstream. Typically, we do this with what is called either an arterial venous fistula or an arterial venous graft. In some cases, a hemodialysis catheter is used. this type of dialysis, this hemodialysis, the blood kind of dialysis, it can be done in a dialysis center or it can be done home. The schedule for this typically is 3 times per week, 3 to 5 hours per session, though it can be done in many different schedules for many different time periods. Next slide. A little bit about in-center hemodialysis. This is the type of dialysis, it's hemodialysis, the blood kind of dialysis, and it's done in a dialysis center. The dialysis is managed by dialysis center staff, and it's usually done on a standardized schedule, 3 sessions per week, often Monday, Wednesday, and Friday, or Tuesday, Thursday, and Saturday, with 3 or 4 hours per session. Next slide. There's also home hemodialysis. You can do this blood kind of dialysis at home. This is dialysis that's done in the hemodialysis that's done in the home. It's managed by you and or a care partner. The schedule is flexible, as I mentioned at the beginning, and the schedule can vary between 3 to 6 times even a week. You can see here a variety of different schedules. It can be done during the day, it can be done during the night, and a real benefit of home hemodialysis is the flexibility of this schedule and being able to do it at times that are convenient for you and work with your life. Next slide. There's also peritoneal dialysis. This is a form of dialysis in which fluid is put into the abdominal cavity. It's left to sit there. We call it a dwell, and it pulls out toxins and extra fluids, and then that fluid is drained out of the belly. Of course, you have to have access into that belly cavity. You can see in the picture there a small catheter that's inserted into the belly in order to get the fluid in and get the fluid out, and that catheter stays in place. And those exchanges, the moving of the fluid in and out of the belly, they can either be manually done or done with a machine. And this is usually performed every day at home, and it can either be done during the day or at night or a combination of the two. So in terms of how much home dialysis is used, it's not used as much as you might think when you hear about the potential benefits of it. So according to the US Renal Data System, which is a big database that tracks dialysis care in the United States, only about 12.5% or so of patients dialyze at home. And in particular, Black and African American patients are 30% less likely to use home dialysis when compared to non-Hispanic white patients. And while Latino patients are 19% less likely than their Latino patients are 19% less likely than their non-Hispanic white counterparts to use home dialysis. The United States also lags behind other industrialized countries in home dialysis utilization. So with that, it is my great pleasure and privilege to bring to us the panel of participants. I hope that provided some good background for our discussion. And I'm going to go ahead and bring in some questions, which I think will be really helpful for the audience in understanding the different aspects of home dialysis. So I'll go ahead and get started. So, and Dr. Perlman, I will start with you. Dr. Perlman, could I ask, what are some of the factors that need to be considered when a patient is choosing between home and in-center dialysis?
Good morning. Thank you for the introduction, and I really appreciate being here today. And I'm so glad that people are tuning in to learn about home dialysis options, because learning about it is really the first factor to considering doing dialysis at home. In this country, doing dialysis in a dialysis unit, usually 3 times a week, like you mentioned, is definitely the default therapy for your kidneys not working. And so if you haven't had the opportunity to learn about home dialysis or things happen quickly, you are going to start off doing dialysis in a dialysis unit. And while there's nothing wrong with that, I think having the opportunity to choose the dialysis that works best for you is really important. So some of the factors in choosing home dialysis have to do with an individual's level of comfort for taking control of some of their medical care. And there is no special medical training except what you learn through your dialysis providers needed to do home dialysis. So you don't need to be a nurse beforehand. You don't need to be an engineer beforehand, but you have to be willing to learn how to do your dialysis at home and feel comfortable with that. Another factor is that some people, when they learn about it, they are comfortable taking that on, but some people prefer to go into a dialysis unit and not have their home become part of where they receive medical care and have their dialysis machine and supplies there. And so wanting that to be outside of the home is totally fine. Wanting to have more contact with medical providers and other dialysis patients, that happens more in a dialysis unit. But if you want to have more control over your schedule and do it on your own timing, being at home really helps with that.
That was an excellent introduction. Let me ask just a quick follow-on that comes to us from the audience there to your comments there, Dr. Perlman. Could you tell us a little bit about side effects? How do people feel generally when they're dialyzing in center versus doing the home forms of dialysis, the peritoneal dialysis or home hemodialysis?
Yeah, that's a great question. And side effects or symptoms on dialysis are really different between different people, but it is common for people who dialyze at home to be less affected by symptoms on dialysis, usually because they're doing it more often. And so peritoneal dialysis is generally a 7-day-a-week therapy. So the downside is you don't get any days off, but the good thing is you never have a weekend without dialysis. And so the side effects from dialyzing tend to be much more mild. Similarly with home hemodialysis, most people tend to dialyze more than 3 times a week, which lets each treatment be a little bit gentler than treatments in the dialysis unit.
Excellent. Let me bring in some of our other panelists here, and let me go to you, Ms. Gedney. As both a patient and an advocate, why do you recommend patients consider dialyzing at home?
So aside from what Dr. Perlman had said, and I want to thank you for allowing me to be here today and talk about the benefits of home dialysis. Home dialysis has allowed me freedom. And for me, that was absolutely key. I am fiercely independent and I really needed to preserve that. So by being able to dialyze at home on my schedule, my terms, my time, that took away a lot of the problems that some people face with dialysis. So I was never depressed from it. I didn't have to turn down family engagements or a spontaneous night out with friends. So independence is key. But also I feel I can't describe, I spent 20 years working on CKD because I wanted to avoid dialysis at all costs. And yet, ironically, once I started on dialysis and home dialysis, which as Dr. Perlman said, is much gentler on the body, I actually started to feel better than I had even during CKD. And today I feel that I'm almost 70, that I'm actually healthier than I've been in probably 20 years. I exercise daily, I eat whatever I want, I take no medications. And all I do is what I call a short daily schedule of home dialysis that just keeps my body recharged. So for me, it's just been a perfect option that has allowed me to continue my life as I wanted to.
Oh, wonderful. Thank you for telling us about your experience. And let me ask a similar question to you, Ms. Williams. Can you tell us a bit about your kidney journey and why you decided to dialyze at home? Oh, I think you're on mute.
Mute.
We had to say it at some point.
Yes, I'm sorry. Hello, everyone. Yes, so I was diagnosed with kidney failure in April of 2016, less than 1 month before I was set to graduate from college. And I had been having some kidney problems. So luckily for me, I already had a fistula that was maturing. But of course, knowing that dialysis was eventually going to come one day, my nephrologist had been preparing me, but I was in the middle of campaigning for international third vice president of my sorority. And so that position, which I actually won, came with a lot of travel. And, I'm thinking back in my first year in that position, I actually had to travel 26 weeks. So about half the year I was traveling, and I was a in-center dialysis patient. And so what that presented for me was a very unique opportunity where I actually had to travel to 19 different dialysis clinics. I treated at 19 different dialysis clinics in the 16 or so months that I was on in-center dialysis. And so if anyone here that is on dialysis who may be an in-center patient or just has general experience with dialysis, many and most dialysis patients don't dialyze outside of their home clinic where they receive their routine, treatments 3 times a week. So for me to dialyze at 19 different clinics is very unique. And it also, gave me the experience to see that dialysis definitely is different. There is no unique dialysis experience because it was a different experience at every clinic that I went to.
Understood. And I think you've you've touched on this obviously, but could you talk to us a little bit more, Leigh-Ann, about how you're able to travel now with the type of dialysis that you do currently?
Yes, so I'm on home hemodialysis. I'm a home hemodialysis patient. I have my next stage machine that I travel with. And, on my journey to ending up on home dialysis, my goal when I graduated college was that I wanted to take a cruise. And, for me, just knowing that, that was the only question I had when they came to my clinic and talked about home dialysis. I said, well, I'll be able to go on a cruise. And they said, yes, absolutely. And so, my machine is it's heavy. It's about 99 pounds, but it's a small machine and it's portable. And so I'm able to, pack up my machine and go. And so, when I now have conferences, so, I've been to Philadelphia with my machine. I've taken my machine to Hawaii. I've taken my machine with me to the Bahamas and done treatments. And so you can imagine, being in a hotel room, doing, going to the Bahamas, being able to do everything you want to do, coming back to your hotel room, being on, the balcony overlooking, the beautiful water and being able to dialyze. And for me, that's one of the things I love about, home dialysis, that flexibility that it provides. And I haven't gotten that cruise yet. I was supposed to go summer 2020, and of course, COVID happened. So still haven't made that cruise, but I have the flexibility for when everything opens back up.
Well, thank you. It sounds like we should get that machine some frequent flyer miles because
Yes,
it sounds like it's doing the rounds. Let me ask a great question here to Dr. Perlman. This comes to us from the audience, from Missy. This is a good question about peritoneal dialysis. So the question is, how long can I do peritoneal dialysis? Is there a time limit on this?
That's a great question. Some people hear that you can only do peritoneal dialysis for so long. And by so long, we don't mean hours, but it's only good for a certain number of years. And there's no time limit for how long somebody can do peritoneal dialysis. They can do it for years and years as long as it is working well for them and meets their needs. It's less common in the US to do peritoneal dialysis for 8 or 10 years, but it's certainly possible. And other countries like Japan, for example, have patients who have been on peritoneal dialysis as a matter of course for that longer time period.
Wonderful. That aligns very much with my own experience with caring for patients. And I think also important to remember, one dialysis modality, a kidney transplant, these aren't destinations. These are part of the journey. People may use many different dialysis therapies throughout their kidney journey. And just because you choose one doesn't mean that's the one you're with forever. There may be another that may work better for you at some period of time. Let me follow on with another question here for Dr. Perlman. As we talked about a bit in the introduction, home dialysis rates are lower among Latino and Black and African American patients when we compare them to their non-Hispanic counterparts. What do you think the medical community can do to help narrow these disparities?
I think that's also a really important question, both to narrow the disparities and to make home dialysis as available as possible to as many people as possible. And part of that starts with education. And so letting people know about home dialysis options as soon as possible. I think as a medical community, we need to assume that everybody is potentially interested in home therapy or could potentially benefit from home therapy and present it as a real true option. Even if you've started hemodialysis in center, sometimes dialysis starts quickly and you don't have time or you're overwhelmed and aren't thinking about other options. Like you said, it's the right therapy at the right time. And so people can transition to home after being in center. It's really important that the medical teams, and I mean doctors, nurses, and social workers, engage with patients and their families and teach them about home therapies. And similarly, patients should feel very free to ask questions about whether it would work for them and what it might look like. A lot of programs that are successful in bringing in new patients start by looking at their own hemodialysis patients and making sure that everybody that they're touching through any sort of dialysis is educated about home therapy. Additionally, I think it's really important that there are other trusted sources besides the medical team. And so since peritoneal dialysis is less common than hemodialysis in all populations, and then in African American and Latino populations, it becomes less likely that you'll know somebody else doing peritoneal dialysis. And many people who do peritoneal dialysis or home dialysis really are enthusiastic about being ambassadors for that type of dialysis. They feel like they're benefiting from it and they want to share that. And so I think it's really important that we tap into people who are actually using home therapy to provide other sources of education.
Let me ask you, Ms. Gedney, Ms. Williams, that was a really nice answer from Dr. Perlman, but as advocates, as patients, what do you think the medical community can do in regards to helping to narrow these disparities? What's your perspective here? I'll start with you, Ms. Gedney.
So honestly, one of the things that I learned early on is that, about 65% of patients crash into dialysis. So you don't have any advanced preparation, which would be ideal. And at that time, it's really hard. First off, you have kidney brain, so you're not always, quite able to comprehend everything. But second, you're just being overwhelmed. And at that point, trying to understand your choices and your options can be truly overwhelming. So one of the questions I always like to ask of people initially in starting is, what matters to you? Because if you can learn about what it is in your life that is important to you, then you can start making the next step and overcome the fear of dialysis and what's you're facing. And then you can start making decisions about a treatment. As you said, during a person's lifetime on replacement therapy, you can do everything from transplant to home hemo to PD and back again. So it's the right treatment at the right time, and the right choice. So I think it starts with understanding what matters to you first, accepting, where you are in your treatment journey, and then learning about your options and what would work best for you.
Indeed. Ms. Williams, do you have a perspective on how the kidney community can help to address the disparities that we see between home therapies and in-center?
Yeah, I think, my colleagues hit the nail on the head when they said, Dr. Perlman talked about just, access to available resources. I have a background in public health, and that's always the first thing I go to when we look at differences is what is the difference in, the access to care and the access to resources. I know even for my own story, when I was first presented with dialysis, this was before I crashed into dialysis, it was presented as, oh, you can do home dialysis, which of course I was in college, but they said it would be 8 to 10 hours at night. And at this time, I'm in college. I'm not sleeping 8 to 10 hours at night. So that wasn't an option for me at that time. And so it was, over a year on dialysis before they came and told me about the home dialysis options that were much shorter treatment times. And so by that time I graduated college and I was in a better situation. I was, back at home. And so I had somewhere to store all of those dialysis supplies. And, the short, 2 hours, 45 minutes to 3.5 hour treatments were perfect for me. So I think, you talk about access to care, access to resources, knowing that different options are out there. And then, just as Nieltje said, right place, right time, right treatment choice. It's all about the patient's choice at the time.
Absolutely. Let me ask a follow-on clinical question that Ms. Gedney brought up. She mentioned kidney brain. So patients with advanced chronic kidney disease develop some symptoms over time. Dr. Perlman, I wonder if you could talk to us a little bit about what someone might mean when they say kidney brain, and some of the symptoms that might appear with advanced chronic kidney disease.
A lot of times when people's kidney disease has gotten worse and it's getting on time for them to be starting dialysis, they start feeling not well in ways that can be subtle or not subtle, but a lot of times that includes a poor appetite, a loss of taste for protein-rich foods, some nausea. Sometimes some nausea becomes a lot of nausea and vomiting. Sometimes a metallic taste in the mouth, and sometimes just really overwhelming fatigue, and not tired like it's time for bed, but really a hard time having that energy to make it through the day, not feeling well rested after you sleep. And going along with that is often difficulty concentrating, difficulty thinking. So I think that's what my colleague was referring to by the kidney brain, that slowing in the thought process that can be a sign of the kidney toxins building up.
Absolutely. And Ms. Gedney, I'll go back to you, but my own experience with this is often for people who have advanced chronic kidney disease that's very slowly progressive, that's going very slowly, as you kind of alluded to, oftentimes the symptoms come on slowly. So you don't even realize how you've changed over time because that change is so slow. I'm interested, Ms. Gedney, a little more in your perspective there on the kidney brain and what you meant, to make sure we've represented what you were describing accurately.
Well, you're absolutely right. It does creep up on you. And especially, as I said, I had CKD for almost 20 years, and it would go up and down a little bit. I was able to control it with diet, exercise, and other interventions, low protein diet. So, I felt successful, but I didn't realize, and you can't, because you're living it. And until afterwards, when I started dialysis, and all of a sudden it was like the fog lifted and I could think again clearly. And I think that's the most important one, because during those years with CKD, I don't think I realized how much I was effective. I still felt I lived a normal life, but it was like living in a fog. And of course, as it progressed, and when I technically crashed, I was at the point where I really don't think I was functioning at all. And now, then within weeks of starting dialysis, the fog lifted. I'm back to a normal life that I hadn't really encountered in many, many years. So, and it's been like that ever since. So I'm actually one of the people that's super grateful that I started dialysis.
Well, I'm glad to hear that you're feeling better. Let me ask a follow-on for you, Ms. Gedney, as well. In the introduction, we talked a little bit about how around about 12.5% or so of people who are on dialysis do dialysis at home with either peritoneal dialysis or home hemodialysis. What do you think can be done to help to increase those figures and help more people benefit from these therapies?
So I go back to what Dr. Perlman said earlier, and that is education. We don't have in this country a really good system of kidney disease education. If you look at what the diabetes associations have done, you could pretty much encounter diabetes education, diet management, everything in every school, church, and location. We don't have that yet. And so consequently, kidney disease really is the hidden killer. We don't see it. And we don't have the education that's available to us. So we really need to work on getting a system of educating people early on, whether they, are prone for kidney disease or not. Everybody needs to understand the benefit, what's happening, so that they can recognize it. The medical community needs to be testing earlier for all of kidney disease and discussing it with their patients, whether you are prone to, or have factors that contribute to it or not. So education is key. I can't stress that enough. And I think we need to start working on getting, standardized curriculums of what we want people to learn and age appropriate levels. So I can't think of anything better, more important than educating our population.
Absolutely. Absolutely. Could not agree more. Let me go over to you, Ms. Williams, and I'll ask you just a little bit about training. Could you talk a little bit about the training you received in order to do home dialysis? Can you do home dialysis by yourself? Does it help to have help? What would you recommend a person ask as they're going through the training process? Can you talk to us a little bit about it?
Yes, so actually yesterday was my 4-year home anniversary. I've been doing home dialysis for 4 years now, and my training was about 4 to 5 weeks of daily training. So I was doing dialysis Monday through Friday, and then having Saturday and Sunday off for the 4 or 5 weeks. And it was full dialysis treatments plus, additional training on, how to work the machine, how to, troubleshoot alarms, how to get everything set up, everything you needed to learn. So it was about 6 hours a day. And that's actually one of the barriers, I think, to some people doing home dialysis is if you are, working or have a work schedule, will you be able to get time off to do the training, or will they accommodate you to do the time you need away from work for training? And also having a care partner. More recently, there are more and more people doing solo home dialysis, but where I am, that still isn't an option to do solo home dialysis, and you have to have a care partner with you that is trained to do your dialysis with you. So that's also a potential barrier that people face is they may be able to do dialysis, but if they don't have someone who can also take off and do those weeks of training, then again they may not be seen as a candidate for home dialysis. For me, I was lucky enough that my grandmother and my sister were able to go through the training. And so I actually have 3 care partners, which is really beneficial because that increases the flexibility as well, because my sister still works, but my grandmother doesn't work. So when I was, in school, I, doing my master's program online, I was able to, go to training and, do dialysis early in the day with my grandmother. So that was definitely one of the benefits. One of the questions I think, people should ask, because it's definitely an overwhelming process when you first begin, because you have, you may know a little about dialysis, and I feel that I knew a little bit more than the average person, but you have to learn the machine. There are specifics for your home when you actually get the machine home in terms of, internet connection, water access. So, there are different things like that. So you want to make sure you have the space at home for supplies, because, for me, I get supplies once a month. So do you have somewhere in your home where you can store a large amount of these supplies, a room for your, kidney machine if it isn't going to be in your bedroom? Another important piece is how involved the conversation you can have is with your care partner. So for me, my care partner being my grandmother, there's not much that I wanted her to do besides, be there to know, but to watch me. And I pretty much do my own setup, my own takedown, everything like that. But not everyone has that option. I know there are older people that end up doing home dialysis, and a lot of times their care partners are fully responsible for the treatment. So knowing how involved you want your care partner to be in your treatments is a very important question I think needs to be asked.
Really?
Absolutely. Absolutely. Got some good questions from the audience that have come in. A couple are about some of the terms that we've used. And I think as people in the kidney care community, we use these all the time and they're second nature in our brains, but to folks who are learning all this stuff, it's learning the new language. So Dr. Perlman, let me ask you, the term crash into dialysis was mentioned. What do people generally mean when they use this term?
So it's not a scientific term. It means slightly different things to different people, but it means starting dialysis in a way that you were not completely prepared for. And when I say it like that, I don't mean to take away how traumatic and awful that is, because when you're not expecting to start dialysis and suddenly you feel sick and you're told you need to start dialysis tomorrow, that's the crash part. Like, oh my gosh, no time to prepare, no time to have the surgery that you showed us about right at the beginning to have the most successful dialysis, but people end up having what's basically a large IV put in the side of their neck to do dialysis and start dialysis very quickly. The good thing is that we can start dialysis quickly in this country. And so if there is an emergency, we can get people started quickly, but it takes away the time for planning, for education, for having time to get your brain around what you're going through.
Absolutely. Absolutely. A follow-on to that question, Dr. Perlman. So we've talked both to Ms. Williams and Ms. Gedney a bit about their home dialysis experiences. And some of the audience are asking about, is it common to run into challenges when doing dialysis at home? I think it's a common concern of people who are thinking about the different types of dialysis. What if something goes wrong? Does this happen a lot? And how am I supported? How do you answer this question when you're talking to people who are thinking about dialysis at home?
So first of all, and I hope what I'm saying matches the experience of Ms. Gedney and Ms. Williams and other people who are doing home dialysis, but we don't send you home until you have had a chance to really learn the therapy. So whether it's peritoneal dialysis, which tends to be a much shorter learning time than hemodialysis, or hemodialysis at home, you practice in the clinic under the direct supervision of a dialysis nurse until you feel okay about going home and that nurse feels okay about you going home. And so we have typical times that takes, kind of like Ms. Williams described, but there's no going home with the machine until you know how to use it. That being said, you spend months becoming really an expert in it. And so we teach you what to do if things go wrong. There's if it's a technical problem, there's a 24-hour number on the machine. But for hemodialysis, I don't like people to do it at night, their first couple of treatments at home, because I want them to feel that they are both wide awake and well rested, and the clinic is just a quick phone call away.
Absolutely. And to follow that on, I'll ask both Ms. Williams and Ms. Gedney, do you have any tips for people as they begin their home dialysis journeys? Ms. Williams, I'll start with you.
Yes, so I would definitely advise people to be patient. Like Dr. Perlman said, they won't send you home until they feel comfortable that you can successfully do your treatments at home, but it's a lot to learn. There's definitely a learning curve. As I mentioned, you have to learn the machine. You have to learn the entire process of doing dialysis. And everyone who's on home dialysis can attest to this. Things are going to happen. You're going to get those alarms, and it's best to stay calm and know that you are prepared. You have your resources, you have your manuals, you have the 24-hour hotline number. So you have everything that you need, and just know that you are trained. You know yourself the best. I always, tell people, I love home dialysis because I know my symptoms. So if I start to feel, funny or feel a certain type of way, I know immediately what I need to do to correct that issue, and I can take that action. And so it's, be patient. It's going to be overwhelming at first, but you get over it, you learn, and to stay calm.
Ms. Gedney, I'll ask you the same question. Do you have any tips for people as they're beginning home dialysis?
I tell people that when I started home dialysis, it truly was, the training was the toughest thing I think I've ever done in my life. I will not deny that it was not easy. Doing a treatment, learning the machine, understanding dialysis, all of that at once, I was completely overwhelmed. So the first thing I did was ask my nurse to slow it down and at a pace that I could, physically accommodate. But the other thing that I think is so, so important, first off, you need to learn to self-cannulate. You can start doing that in center if you, are an in-center patient, because that's just really important. And it takes you, and this is the key, we try to tell everyone, you have to go into it committed to take that first year, because that's your learning curve. It takes almost a year to really get your fistula where you understand it. It's a living, breathing thing. It's constantly changing. It's frustrating. So that first year is critical. And you're going to have, I always tell people the alarms. The people, they feel that they're unsettling, and I'm like, no, because the alarms are working, and that's what's important. There's nothing that you can do on your home treatment that can really harm you. You're going to have some blips along the way. We kind of joke about it. It's like a rite of passage, baptism. But the bottom line is that once you've made it through that first year, the rest of it's seriously, it becomes like brushing your teeth.
Those are really excellent tips from both of you. And let me get the physician perspective from this. Dr. Perlman, how do you counsel people to get the most out of their home dialysis treatments? Is there particular information that's really helpful for you as a physician that people track on their home dialysis treatments to help you give them the best advice possible?
Absolutely. I think that when you're doing your home dialysis, you become, as I think both of my colleagues just said, an expert in your own care and your own body. And while that certainly doesn't replace medical advice, it lets you be prepared to do some early troubleshooting. And so I like my home patients to be as absolutely involved in their treatment as possible, to feel, for hemodialysis patients, to feel very capable using their fistula, which is how we get blood through the dialysis machine. For peritoneal dialysis patients, to anticipate how much fluid they want the machine to remove in a night, and to understand how their body responds, because they are the first best signal that something isn't going right, or when they're giving themselves the thumbs up that something is going right. But communication is the other thing. So although being your own expert is really important, anytime there's a problem, that's why we have a home dialysis unit set up to support you at home. And if something's not right, call.
Absolutely. And I think we've touched on this question a bit, but there's another question from the audience asking, if I go to home dialysis, can I ever go back and do anything different? And I think we've touched on it a bit, but Dr. Perlman, I'll put it to you.
Yeah, and I see everybody nodding on this one, but when you learn to do a therapy, I don't ask you to like it in the first month or even in the first 6 months. We want to help you troubleshoot and be as successful as possible. But if a dialysis therapy either isn't what you thought you were getting into and you want to change, or your medical needs have changed and you want to change or need a change, people absolutely switch modalities and switch from one kind of dialysis to another. So I want to be clear that that is absolutely possible.
Absolutely. These aren't irreversible decisions. Let me ask you, Ms. Gedney, have you ever run into any major issues with your home dialysis, and how did you overcome these issues when they came up?
So early on, and I want to say literally during the first 6 weeks of training, I was at home and I had an infiltration. and I was obviously new and couldn't quite, I didn't even know how to stick myself with the big bruise. So I asked my nurse to come by and cannulate me that morning. And something went wrong. And after she left, it literally blew out. My needle went flying across the room and I was obviously bleeding profusely. And while I never had a care partner, I did have someone in the home initially early on. And they tried, we did everything we could to stop the bleeding and ultimately called 911. And I live in a small area, everybody knows everybody. And, 6 of these really gorgeous guys showed up, EMTs, and stood in the room and were like, so now what do we do? We're all talking and chatting, and eventually the bleeding stopped, and I drove myself to the ER and everything was fine. And, that was it. I guess, the old saying, keep calm and carry on, because again, even that, which was scary, I was very new, it was not life-threatening. I mean, I guess I was losing blood. It was a little intimidating, but, overall, I remained calm. And when the guys showed up, and since then, I've really had no other issues that I needed assistance for. And that's kind of hard, sometimes one-handed, being able to remove your needles and do all the procedures that are required, you have to be adept, but I go slow. I do what I can. You'll forget a clamp once in a while, but as I said, they're all blips in the road, and they're just there to remind you, to pay attention and, learn from your mistakes.
Sure, absolutely. And I don't recommend this particular technique for meeting attractive people in your local area, but fantastic to hear that was part of the experience there. Let me ask you, Dr. Perlman, another question from the audience, a kind of a clinical question, an operational question. How do people do labs while they're on home dialysis? People, when they're going to the outpatient say chronic kidney disease clinic, are often used to going to their lab, getting their blood work done. It goes to their doctor. How does this work for people who are on home dialysis?
What's very typical for people on home dialysis is to go, once they're trained, to go to their dialysis clinic once a month. And during that visit, see the nurse, the dietitian, the social worker, and the physician, to have their labs done as part of that visit, to have any medications that they need given, or review of their technology done at that visit. And so we try and make it a once monthly comprehensive visit, so you're not coming to the clinic so often. A lot of times people on home dialysis, on home hemodialysis, also will, once they get good at this, they'll draw their own labs while they're already connected to the machine to avoid an extra needle stick.
Absolutely. A question here that had come up a bit earlier. Again, the audience is interested in this. Ms. Williams, I'll direct it to you. Can you talk to us a little bit about your diet on home dialysis? People are often counseled extensively, particularly when they're on in-center dialysis, about restriction of certain things, moderation. Can you talk to us about what that's like for you on home hemodialysis?
Yes, so for me, another proponent for a while, I switched to home dialysis. So in terms of food, I still try to stick mostly to the kidney diet. So I'm still, for me, luckily, like everyone is different, I don't typically have problems with my potassium and my sodium, but I still, try to watch those. But of course, my phosphorus and taking my binders. But for me, switching to home dialysis allowed me a little less restrictions in terms of fluid intake. So when you're in center, you're only doing dialysis 3 days a week. And so they want you to limit your fluid to 32 ounces a day. So that's, 4 8-ounce cups of water for the entire day. And so for most dialysis patients, I know that is one of the things we struggle with, is fluid overload. And so that can be very harmful to us. It can cause, swelling, it can cause problems with our heart, and can really be dangerous. And it's one of the, bigger risks of dialysis is that fluid overload. So by doing home dialysis, I still don't go overboard, but I am allowed to drink a little more fluids because I'm dialyzing more frequently. I do 4 days a week. And so sometimes I have those back-to-back treatments. And so I can have a little more fluid and a little more flexibility in my diet in that way. But I'm still making sure I get my protein in, still making sure I'm limiting that phosphorus and those potassium, because those monthly labs come in and you don't want to get a lecture about your numbers being high.
Anything to avoid a lecture. Well, this has really been a wonderful and excellent discussion. I think the panelists here have really raised some really important points about home dialysis. And I want to kind of bring it home here a little bit with some main takeaway points that each of you want kidney patients to know about home dialysis. I'll start with you, Dr. Perlman. What are your sort of main takeaways for the audience today?
So a couple of things. First, listening to Ms. Gedney and Ms. Williams describe their experience with home dialysis is, as a nephrologist, what my goal is for people doing dialysis. And so it's not just doing dialysis to get by, but to really feel well and be able to enjoy your life and to travel or work or see family or do the other things that are important to you. And so what I want to stress about home dialysis is one, the flexibility of therapy. If you want to do it earlier in the morning, you can. If you want to do it later in the day, you can. And if you are going to a dialysis unit, if you don't show up at your exact time, the staff is going to get cross with you. Yes, they'll probably give you a lecture. Your treatment will probably get shortened. And so the flexibility of doing dialysis at home is really unique. Many of my patients who do home dialysis express being so pleased with their therapy that they want to talk to other people on dialysis and let them know how well they feel and how glad they are that they're doing it at home.
Absolutely. I think giving back to the community and becoming an advocate yourself is such a wonderful thing to bring. And I think Ms. Gedney and Ms. Williams, you guys are wonderful examples of that. Ms. Gedney, I'll go over to you. What are your key takeaways for our audience today around things that people should know around home dialysis?
So the number one thing that home dialysis did for me is I dialyze to live. I do not live to dialyze. So it does not control my life. That for me is key. And yeah, there are trade-offs because I basically am doing all the work of a clinic at home. I manage my supplies, I do my treatment, I keep my room, the room clean, everything that is done by the clinic. And that's a bit of a workout. But for me, that's worth it because I have my independence so that I can do what I want when I want and continue to live my life to the fullest. And so I think that's it. It's a trade-off. You take the good with the bad, but the bottom line is that I dialyze to live.
Absolutely. A wonderful message. Ms. Williams, what about you? What are your key takeaways for our audience?
I think home dialysis is an excellent choice for some kidney patients, but of course, it isn't for everyone. My mantra is these kidneys won't hold me back. Home dialysis has allowed me to get a full-time job, and I'm able to work and do dialysis after work. I'm able to be involved in my community, still in my sorority. I'm able to travel and live my life as close to a normal 28-year-old as possible. And home dialysis makes that possible. Like Ms. Gedney said, you have to take the good with the bad, and some days are challenging. Like Dr. Perlman said, sometimes, I say I'm going to get on at 8 and it ends up being 8:30, but, I have that flexibility on home dialysis. And so right now, it's the perfect choice for me.
Well, thank you, Ms. Williams, and thank you all so much for joining us today to talk to us about home dialysis and the many points and learnings that you've raised. I really can't wait to bring you all back on for more chats in the future. I think this has really been a wonderful session. Thank you to everyone at home and at work for joining in with us too. As a kidney community, coming together is such a wonderful thing. To help to bring awareness to kidney disease and to the options for treating it. So very wonderful to have you all today. If you aren't already, follow us on Facebook or send us your email through thekidneyfund.org, and you'll be able to, you'll be the first to know about resources like this one today. Also, make sure you check out the agenda for the rest of Kidney Action Week. There are many wonderful talks to attend, and I highly encourage you to do that. Join us today at 12:30 Eastern Time for Know Your Kidney Healthcare Team, Effective Communication for the best health outcome. That will be a wonderful session. It'll feature a distinguished panel providing advice on how kidney patients and caregivers can effectively communicate and work with their treatment teams. The session will be ending, and you'll see a link for a quick survey appear in a green screen below, and please take a few minutes to fill it out. Your feedback will be very useful as we plan future sessions. Thanks, everyone, and have a wonderful day.